Welcome to the Rim Break Rodeo. We hope this video helps.
In this video, I will explain how to solve NCLEX case studies. First, familiarize yourself with the structure of these questions, which often involve a patient scenario followed by multiple choice or multiple response items. Begin by carefully reading the entire case to grasp the overall situation. Then, pinpoint the most crucial patient data and presenting symptoms to form your initial assessment. This foundational step is vital for accurate problem identification. Once you have the initial picture, thoroughly evaluate all the information presented, such as laboratory values, vital signs, and medication lists. This comprehensive review helps you identify potential issues. Next, determine the most critical nursing diagnoses that require immediate attention, often using frameworks like Maslow's hierarchy. Finally, formulate a clear and evidence-based plan of care, outlining your intended interventions and expected outcomes. With your plan in place, select the most appropriate nursing interventions that directly address the identified problems and diagnoses. Think about the rationale behind each action and how it impacts the patient. It's also crucial to anticipate potential patient responses and complications that might arise from your interventions. Lastly, evaluate the effectiveness of your chosen actions, considering if the patient's condition is improving or if adjustments are needed. To truly master NCLEX case studies, consistent practice is key. Work through a variety of scenarios to build your critical thinking skills and confidence. During the actual exam, manage your time wisely, allocating sufficient time for each case without rushing. Remember to stay calm and focused. Also, staying hydrated is important for concentration, so check the description for a link to a great water bottle and other helpful deals. Good luck with your studies.
Thanks for watching. Consider subscribing if we helped you.